Good morning, everyone. We're going to let more people join and we'll get started in a couple more minutes. Thanks for joining today. Hi, everyone. My name is Sarah Viviani, Director of Marketing at the Fidelity Group, and welcome to today's webinar, Engaging and Empowering Your Medicare Eligible Employees. Before we get started, I would like to go over a few items so you know how to participate in today's event. You may have joined the presentation listening using your computer speaker system by default. If you would prefer to join over the telephone, just select phone call in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenter by typing them into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address them during the Q&A session at the end. I would now like to introduce Kathy Herco, founder, president, and licensed insurance agent at Kaz Company. Kathy is one of Ohio's preeminent experts on Medicare. She has represented a multitude of companies over the last 12 years. You might have seen her featured on WKYC, WEWS, or even heard her on WTAM 1100. Knowing Medicare can be overwhelming and confusing, and she works with people educating them on the best ways to best suit their needs. And actually, since our last webinar, Medicare 101 webinar, we have had the pleasure to bring Kathy and her team into the Fidelity Group family. It's been a privilege to work with Kathy. I personally have truly learned so much, and I look forward to our future together. Thanks for being here, Kathy. I'm excited to share today's agenda with you. Kathy will be covering the following topics. She'll first be kicking things off with the common dilemma HR staff are currently encountering, followed by the Medicare basics. This will serve as a strong foundation before she covers helpful strategies to deploy and resources to share with eligible employees. We will close the presentation with the submitted questions. All right, Kathy, the floor is yours.
Thanks, Sarah. And thank you, everybody, for taking the time out of your busy day to join us here. And I want all of you to know, first of all, that it is very much a pleasure that Kaz Company is now a part of the Fidelity Group. Fidelity is a great company, and selfishly, I think my team is a great company. So I think together we're able to do a lot. The one thing that I want everybody to know is this is an educational seminar. Plan specifics will not be discussed. However, down the road, if you wanted some plan specifics, you could reach out to either Sarah or myself, and I could get the questions answered for you. So the HR dilemma, how did we get here? Some fun facts, basic facts for you. Some of you may know this, some of them not. But approximately 3.8 million baby boomers are expected to turn 65 each year, which averages about 10,000 people a day, and that is true. Most baby boomers are not exiting the labor force, unlike the older workers. baby boomers don't know how to retire. We just keep on going. I have an older mom, and she says, my age group, we were done, but you guys just keep on going. Boomers age 65 to 72 were working or looking for work. 66% of adults ages 54 to 64 were in the labor force. And I will also share with you, some of you may know better than me, COVID has also factored into some of this even more, because some people who thought they were going to retire, cannot afford to retire and need to keep working. And HR must continuously align the pieces of a diverse workforce puzzle. So all of you are very busy. Eligible staff overwhelmed with the decisions. What do we mean by this? 40% of Medicare beneficiaries and 57% of those nearing eligibility admitted they are overwhelmed at the idea of finding the right plan. Many of those nearing this eligibility don't know where to start and say official resources like Medicare.gov are confusing. If you look at CAS Company's business card, it says, ask us about the maze. People do tell us, the more I read, the more confused I get. And this is, in fact, why CAS Company's division of Fidelity, we only do Medicare plans. 19% of Medicare beneficiaries enrolled in a plan without any outside help. They come in, they say, my mother said to get this, my brother said to get this, and Medicare plans are very individual. Half of Medicare beneficiaries, 51%, and 3 in 4 Americans nearing eligibility, 72%, will choose a plan based on affordability. This is true. Many factors play into how people choose a plan, and one of them is affordability. So what are the basics of Medicare? What is it and who is it for? We're going to try and do this today without making it excruciatingly confusing, and we're going to try and lessen the confusion for you. So Medicare is a federal health insurance program eligible for U.S. citizens and legal residents. It's funded in part by taxes you pay while working. People are paying into this, and they must pay into it 40 quarters or 10 years in order to be eligible. It is individual health insurance. Even when we meet with a couple, we will say to them, we're used to being on a family plan, a couples plan. This is a plan for you and a plan for him. As it says here, Medicare is not a family health plan. It is not Social Security. It is not Medicaid. Medicaid is impoverished. And it is not free in that if you haven't paid into it, you do have to pay for it. And Part B of Medicare does have a premium. Social Security overview. It consists of retirement, disability, and survivor benefits. People can start receiving benefits as early as age 62 or as late as age 70. Full retirement age does depend on their birth date. Yes, the longer you wait, the higher your monthly benefit will be. And you can get Social Security retirement benefits and work at the same time, and depending upon what age you take it at, will also impact how much you can make. Age to receive, this is just a chart, a basic chart. I don't think we need to go through the whole chart. But the note at the bottom, if you were born on January 1st of any given year, refer to the previous year for full retirement age. And the one thing that you can see is if you were born in 1938, 39, it's 65 and 2 months, 65 and 4 months. But then you get into the 1940 to 54. Now we're getting into 66. In 1960 or later, you're looking at 67. So who can get Medicare? Legal residents must live in the United States for at least 5 years in a row, including the 5 years just before applying for Medicare. You must also meet one of the following requirements: age 65, younger than 65 with a qualifying disability. In case people ask you, because there are employees who have spouses who are on disability. If someone is on disability for 24 months, they then become eligible for Medicare, and then they can possibly opt out of the employer plan and utilize a Medicare plan. Many people do not know that. So it's 24 months of disability, and then they become Medicare eligible. Any age with the diagnosis of end-stage renal disease or ALS, and as I had stated before, they have to have worked and paid taxes for at least 40 quarters, which is 10 years. And the Medicare card you see in the corner, in order for people to opt out of a company plan and utilize Medicare, they need to have Part A and Part B. Okay, so if everybody will say to us, what is Part A, what's Part B, what's Part C, what's Part D? This is something that we're going to touch on. What does Medicare cover? Part A. Part A is hospital. Inpatient hospitals, skilled nursing facilities, hospice care. Again, there is no premium as long as they have worked 40 quarters. And I did have a lady say to me, I've worked 36 quarters. Should I work those extra quarters? And my response was, yes, you want to do that. And no, they cannot be denied, but it does have deductibles and copays. Medicare Part B, it's physician's visits, outpatient surgery, it's durable medical equipment, some home health visits. Yes, there is a monthly premium. So sometimes people will go on Part A and they won't go on Part B. Why? Because I'm on the company plan and there is a premium for Part B. And this is something that I wish financial planners would tell people. The monthly premium is income-based. It's based on an individual's tax return from 2 years before they sign up for Medicare Part B. So we are in 2021, which means that Social Security will go back and look at their tax return from 2019, and that depends on the monthly premium. The average monthly premium for many of the individuals is $148.50 as of today. There are deductibles and coinsurance. Again, it can't be denied. And people do pay from Social Security if they are on Social Security. It will automatically be deducted. However, with so many people not wanting to collect Social Security, Social Security will send them a bill. They get that bill out as fast as they can. And people can pay electronically, they can pay by credit card, or they can pay by check. And yes, this is something, and this is where there's a lot of confusion. There is a late enrollment penalty if people turn 65 and do not have what is defined as credible coverage from their employer. So if one of your employees would come to you and say, okay, I'm 65, do I need to get Part B? The answer is no, we have a plan that meets credible coverage in the eyes of Medicare. Here is a form to show you that. However, if you are in a position where you do not know that answer, you need to ask the company, the agent, whoever is handling your group insurance, such as the Fidelity Group. You would just reach out to them and they would supply you with the information. As long as the individual has credible coverage, they do not need to get Part B. If they don't, then they need to get Part B. Otherwise, there would be a penalty. So there's some confusion for people as to what Medicare covers, what it doesn't cover. And I'll be honest, when I was getting my license, I was confused by it. Medicare Part A and Part B does not cover prescriptions. That happens to be Part D. And I tell people, just remember D for drugs. It does not cover routine dental, vision, or hearing. And some of you may see all the commercials that say we can give you dental, vision, and hearing. That's on the Advantage plan side, which is the plan that goes with Medicare. It is not with Medicare. They don't cover glasses or contacts, hearing aids, custodial care. This is another area of confusion. Even if the individual is ill, such as my father was, he had dementia, and initially I thought helping him shower and things like that were covered. That is not. That is considered activities of daily living. So your activities of daily living are not considered medically necessary. And if you want to remember 2 words to tell people, remember medically necessary. If something is not defined as medically necessary, it is not covered by Medicare. It also does not cover excess charges for services by doctors who don't accept Medicare, care received outside of the United States, except for emergency situations. How much does Medicare cost? The premium for Part A is 0. The deductible as of this year is $1,408. Then you see the other costs for the hospital. But the one thing you need to know is that is where we sit with people and say you are not required to get anything to cover what Medicare does not cover, which is 20%, but you're exposed for 20%. And that's what Cas Company does. We sit and we help people understand how they will not have to pay that deductible or those other costs. The screen. Part B. Okay. What does? There is a premium. Now here it's $144.60. It's gone up this year to $148.50. There is a Part B deductible. Medicare determines the Part B deductible. It's $198. I got into this industry 13 years ago. At that time, it was $141. So does the deductible go up? Yes, it does, but it's crawled over the 13 years. And as I mentioned a little bit before, 20% of approved amount for most covered services. So Part B covers 80% of medical. Part A covers 80% of hospital. The individual is exposed for the other 20%. And there is no out-of-pocket limit. And this is the question. This is where people come in and they say, okay, the more I read, the more confused I get. How do I know what to do? And the one thing that I would recommend that all of you remember is when people are on an employee plan, traditionally it's, do you want Plan A or Plan B? So they have an option of maybe 2 or 3 plans. When they get into the world of Medicare, it's, do you want a Medicare supplement or do you want a Medicare Advantage plan? And under a Medicare supplement, there are a lot of options. And under a Medicare Advantage plan, there are a lot of options. So we help people understand, number one, the difference between these types of plans, and number 2, their options once they choose which type they want. Another fact for you before I do a deep dive into this, and you may or may not know this, nationally, Northeast Ohio is considered one of the hot spots in the entire country of Medicare eligible people. So because of that, you're all in the workforce, you understand where there is a large population of people needing something, there are many, many choices. But again, you don't need to know all of that. That's what we do. We're here to take that off of you. So when somebody goes onto Medicare and they say, okay, if I don't go on, stay on the company plan, what can I do? We'll say, well, you can get a Medicare supplement, which helps pay the out-of-pocket costs that Medicare does not cover. or they can get a Medicare Advantage plan, and they work very differently. On the Medicare supplement, the individual has 3 cards, 3 premiums. They have 3 cards, 3 premiums, and they pay those premiums every month, whether or not they're using the insurance. What is the 3rd card? You see on the screen where it says Medicare Part D? That is the 3rd card. And again, I don't know if you necessarily, well, you probably may want to know this. They don't have to get the supplement when they're on Medicare, but they're exposed for 20%. They do. It is required that if somebody is on Medicare Part A and Part B and they do not have credible coverage in the eyes of Medicare, they need to get a Part D prescription plan. If they don't, they would pay a penalty when they went to apply for it, and they paid that penalty the rest of their life. So I did have an incident where an employer did say to me, we have a plan, but it does not meet credible coverage. So that meant that their employees needed to get a Part D plan, even if they stayed on the company plan, because it did not meet credible coverage. Or they can go on a Medicare Advantage plan. Now, when they're on a Medicare supplement, they can get coverage. They can get covered from anybody as long as they accept Medicare. And it is medically necessary. On a Medicare Advantage plan, they are networked. They are networked, as you see on the screen. It says HMO and PPO. HMO means you stay in the network. PPO means you go in and out of network. And I'm not going to get into too many details on that because that's another whole presentation. However, if any of you would like to know, the HMO network in this area is very large. Again, we have a large population of people who need Medicare, and number 2, we have the Cleveland Clinic University Hospital in Metro. And traditionally in this area, it includes their prescription drug coverage. So they meet the requirement for their prescription drug, which for somebody who may not be taking any medications, they like that because they're like, why do I want to pay for a plan that I'm required to get when I don't take any prescriptions? And when we meet with people, we explain the differences. So if somebody says, I'm eligible for Medicare, I'm on an employer plan, what should I do? We do recommend that they take the time to educate themselves as to the cost to be on the employer plan and the cost to go on Medicare and utilize one of these. And if the employer is charging a little bit more for a spouse to be on the plan, sometimes they'll go, okay, I'm going to stay on the plan, but my spouse is going to come off. What is Part D? As I said, remember D for drugs, because people say to me, well, what's prescription drug coverage and what's Part D? It's one and the same. Average Medicare member, I don't know what that, prescriptions per month, that talks about how many prescriptions the average person, and the average individual does take, I believe, about 5 to 7 prescriptions a month. It could be less. We find people run hot and cold. Some only take 2, some takes 12. But the thing is, remember, when people are reaching Medicare age, many of them are on maintenance medications. And they may not go to the doctor, but you're going to take your prescription drug plan. So the Part D portion of this is very important. Now, they can get it either as a standalone plan, which would go with the supplement, or it can be included in the Advantage plan, as I just touched on before. What is a formulary? So something that a lot of people don't realize is Medicare requires that every prescription drug plan out there covers at least 2 medications in every category. which means 2 in the cholesterol category, 2 in the diabetes, 2 if you're dealing with eye issues. They have to cover 2 medications every category. However, there are a lot more medications out there than 2 in different categories. So the formulary shows the list of the medications that the plan covers. And right now, there's about, I think, between 25 and 29 prescription plan options available in this area. So we do recommend people have a prescription review to find out what plan will cover their medications. They do have network pharmacies. Why do they have network pharmacies? Because people pay lower copays for their medications when they go into the network pharmacy. It is offered through private insurance companies, the Anthems, the Aetnas, the Uniteds. Yes, there's a premium to be on the plan. There are copays for medications, and medications are tiered 1, 2, 3, 4, 5. So we tell people the lower the number of their medication tier, the lower the copay. And some of the prescription plans do have deductibles. Not all of them do, but some of them do. Another important factor, this is very important for all of you to know. Prior to my coming into this room, I sat with a couple, and he is losing his company plan due to retirement at the end of April. I told him he has 63 days, as it says here, to go on a Medicare Part D drug plan to avoid that penalty. So if one of your employers should ask you, they have 63 days from the day the company plan ends. Take a sip here. Excuse me, I just took a sip of coffee. Okay, when can I enroll? Well, people will say, I turned 64 and I'm getting all of this information. So that's because your initial enrollment period is coming up. You can enroll in a plan 3 months before you're 65, the month of your that you turn 65, and 3 months later. That is called your initial election period. And seriously, we do not ask any health questions. So I will have people who come in with major health issues and they're nervous wreck, and I say, we don't need to know. And then it also says it's a qualifying event. That's falling into a special election period. There is no, as I touched on, there is no medical underwriting as long as you enroll in your initial election period. Now here it says 6 months after the month you turn 65. That is if somebody wants a Medicare supplement. The prescription plan has different enrollment time. Remember I said 63 days from the day, but the supplement, they can go within 6 months, no medical underwriting. If they enroll later, they're going to have to answer health questions, and based upon their answers, they may be denied or their rates could go up. Touched on special enrollment period. Now, working past 65. Okay, it's for again, you have, this is going to get a little confusing. When somebody is working past 65, they can enroll, see where it says month after the last month of employment or employee health coverage. So if somebody retires on July 2nd and coverage goes till July 31st, they're going to go with that July 31st date because they're still covered. Then you have 8 months to enroll in Part A and Part B. That's the Medicare portion. And then you have 2 months, the 63 days, why the 3 days, God only knows, but it's 2 months, to enroll in Part C, which is an Advantage plan, and or Part D. Because if somebody goes on Part C, which is an Advantage plan, that prescription drug coverage is included in the Medicare Advantage plan, But the Part D separate here is if you're doing a supplement. Okay, we get a lot of questions about this. And that is HSA accounts. I have an HSA account. What can I do? They can continue to contribute to the HSA account up to 6 months before enrolling in Medicare. Why would I want to stop? Well, number one, because you have a large tax implication. And they may want to have more detailed conversation with you about it, but people call us all the time and say, I've contributed to my HSA 2 months ago. What should we do? And we tell them, well, you're going to get hit with a major tax issue unless you wait 6 months, and then you won't. Can I use my HSA money to pay for medical expenses when I'm on Medicare? Yes, you can. That's an easy answer. Yes, you can. So, decisions for Medicare eligible. I'm working past 65. What do I do? Workers who are turning age 65 and work for an organization with fewer than 20 employees must enroll in Medicare. Okay, what does that mean? Basically, Medicare states if it's a company that has fewer than 20 people working for them as employees, Medicare is the primary. Medicare is the primary, and then they can use the company plan as a secondary, or they can choose to opt out and do a standalone plan. Those working at organizations with 20 or more employees may choose whether to enroll in Medicare before retiring. What does that mean? Well, if it's over 20 employees, the company plan is primary and Medicare is secondary. However, people can choose to opt out of the company plan and go on Medicare and still continue to work and still continue to not collect Social Security. And that's something that I like to stress right here is many times people will say to me, will my employer be upset with me if I choose to opt out when I'm turning 65 and it's not the time of the year when we make a change? People are allowed to opt out of their plan at any time unless your organization says that they cannot. People also have a lot of confusion. I'm turning 65, I'm still working, I don't want Social Security, I can't go on Medicare. Yes, they can. So people are very confused. They think that they have to stay on the company plan because they're continuing to work and they're not retiring. They need to know, no, they can unless your organization says they cannot. When can I change my coverage? Okay, so it says switch from original Medicare Part A and B to Medicare Advantage, switch from one Advantage plan to the other, or join, switch or drop a Medicare prescription drug plan. In basic English, what this means is, and you have probably seen the commercials. So at your company, you have a specific time of year that people can change their plan. That's what Medicare annual enrollment is. Medicare annual enrollment is when somebody is on a Medicare plan, they can make a change. It's October 15th to December 7th, and the plan will not go into effect until January 1st. But if somebody wants to know, well, do you know if I can change? And in all sincerity, this is something for your information, but this is something that you can just tell your employees, you know what, give Cass Company a call. They can answer the questions for you. We can better explain it. I'm sure all of you have a lot going on due to COVID and the confusion, and this is just going to add to the confusion. we can explain it to people. The simple answer for your employees would be, I know there's a specific time of year. I can't remember the dates, but give us a call. But if you want to know the dates, it's October 15th to December 7th, and it does not go into effect until January 1st. Helpful strategies, what can I do? Okay. This is more internal. You can, and I'll go through them, conduct data analysis. That's to do your analysis of looking at how many employees are approaching 65. And I had referenced this before. As soon as they turn 64, they're going to start receiving. It's about 2 months in. I know when my husband was turning 64, about 2 months in, he got his first piece of information about Medicare. You know, review the benefits program. We recommend that people review their plan and then do a comparison. And we do the comparison for people. We do not charge. There is no obligation. And due to the amount of people that are turning 65, believe me, if your company's plan is better than Medicare, we have no problem telling people do that, stay on your company plan. However, I want all of you to know, sometimes people say to me, will my employer be upset if I come off the company plan? And our response is, we have a feeling that they wouldn't mind. We have a feeling they wouldn't mind. You know, educate Medicare eligible employees about Medicare. So what CAS company does with Fidelity is you cannot direct people to Medicare. You cannot entice them to go on Medicare. However, you can bring people in, such as my team, to educate them and get into what I just touched on very briefly. What is Medicare? What is Part A? What is Part B? Why would I consider it while I'm still working? So we like to call it a Medicare 101. We will come in and we will do a presentation to them to help them understand what Medicare is all about. Encourage employees to create a Social Security account. People who are not collecting Social Security, they can still create an account, and if they decide that they want to go on Medicare, the way for them to sign up, they used to be able to go into the Social Security office. I do believe that they are starting to open up a little bit now by appointment. However, they can apply for Medicare Part A and Part B through Social Security and still not collect Social Security benefits if they don't want to. You can help employees understand how the company's retirement program works. People will always say to us, you know, this retirement thing is very confusing. It is, because they have to make decisions and they're thinking about the rest of their life. So it is a little bit I know it's a lot overwhelming for people. And the other thing is there's a fear factor involved. My paycheck's going to go away. I got to make the right decision. Leverage companies' 401k and group health plan administrators. Consider providing retirement/Medicare educational seminars. I touched on that briefly with the tab above. We will do lunch and learns. We will come at the end of the day if you think you would prefer to have people do that. Some employers have actually had us do Medicare 101s, and then they will set up a day where they'll have one of my team come in, and they'll have like a conference room and allow their employees to set up a time for a half an hour, 45 minutes, or an hour to do a private consultation so that the employee can ask very specific questions. Because sometimes the fear is, I have a spouse that is dealing with major health issues. We're on a medication that's very unique. What about coverage for that? And then to provide Medicare and Social Security literature and handouts. And I know that the Fidelity Group is sending out information to you on a regular basis, not only for yourself, but also for you to pass on to your employees. Where can I direct employees? They can go to Medicare. They can go to Social Security. OSHIP. OSHIP does top line. OSHIP does top line. If they would like more detailed, they can give us a call, or you can also have them reach out to your Fidelity contact, and that individual can help you also. So there's a variety of resources available for them.
Great. Well, thank you, Kathy. I feel like every time you walk through this information, I learn something new just of how complex Medicare is. So thanks again. I'm sure the listeners felt the same way as well, and which can probably lead to some questions. So let's get to it. We're now going to begin answering the questions submitted during today's presentation. As a reminder, you can still submit questions through the questions pane in your attendee control panel. So let's see if we've got any questions that have come in. And then, of course, please feel free to add some more as we go through. We have about 19 minutes of time. All right, here we go. Can my employee enroll in both Medicare and the group plan? And why would they do that? Is there any benefit to having both?
And I'll sincerely know. You're paying for double coverage. So, we did have an individual. I just met with him last week, and he says, well, I've got Medicare Part B. I've got, my company plan, and we're like, you're overinsured. So this is why we recommend that people take the time to educate themselves. And sometimes they go, really? Well, because you want to understand what your options are.
Sure.
And many times they find out, wow, Medicare's less. I don't have a large deductible. On an HSA, there's a large deductible. Now, if they say, well, my employer is contributing, we will take that into consideration when we are doing a comparison. We will definitely take that into consideration so that people can see what kind of cost they're looking at. But the easy answer is no, they don't need it, because then they're paying for things that they're not using.
Gotcha. All right, next question. What could I advise my Medicare eligible employee to do when his spouse isn't 65 yet and not eligible for Medicare?
Okay, so that's a good one, because there's a couple of different options. It depends on the age difference. So like if sometimes people will say, I'm 65, my spouse is not quite 64, they're going to be 64 in 2 months. Sometimes the option is COBRA. Okay, that sometimes is an option. The other option is there are individual plans available for people. There are individual plans available for people, and they can look at the options there, look at the costs. And then if it's really a short window, like 2 months, then they could even do short term. Your spouse can go on short term. The other thing is, though, like if it's a 5-year gap or something like that, then they may just need to stay on the employer plan unless that spouse is working. If that spouse is working and they haven't taken coverage through their employer because they've been yours, they may want to look at that, because then you do a comparison of what's the cost to be on an individual one, what's the cost. So again, there's a little bit of homework on that side.
Okay. All right. Can Kathy or one of her team members visit with my employee at his home so his wife can participate in the meeting? I don't need to be part of those meetings, do I?
No. I mean, the team can do a couple of different things. We can go in, we can do home visits. There's no cost, there's no obligation. We can meet with you as a couple, or we can meet with that individual. The only thing is, if you are both going on a plan, a spouse cannot sign for the other spouse unless they are the legal guardian.
Interesting.
Yeah, they cannot sign. No, this is, again, remember, Medicare is very individual.
Right.
So, they always use this example. You're in a couple's home and the wife doesn't feel well and she goes to sleep. You got to wake her up if she wants to sign up for a plan.
Interesting. All right, next question. Are there any restrictions on flexible spending accounts similar to HSAs?
I'm not very familiar. That one I'd have to reach out to somebody in the Fidelity group. We get more questions about the HSA than we do. Sorry, I don't mean to, but this is something I really would prefer that they reach out to you.
Absolutely. Okay. If my employee goes on Medicare, can she still be on our other benefits, such as dental and vision?
That depends on the employer. We're finding a lot of times they can. Reason being that because they're getting a good benefit, the cost is less if they stay on. So many times the employee will say, well, we're going to keep our dental and vision through. I talked to my HR department. I talked to them. We can still keep it. So again, it's not a definitive answer, but many times they can.
Okay, great. All right, let's see if there's any more questions. What would be the next step in order to schedule a meeting with interested Medicare eligible employees?
So if you would like for us to do a Medicare 101, all you would have to do is either reach out to your contact through the Fidelity group, or you could call my office, and then we could set up a time for somebody to come in. And again, we can do lunch and learns. We can do breakfast meetings. We'll come in with our coffee and our cupcakes. It is getting warmer out, so if there is concern about COVID, if you have an area in your parking lot or somewhere, and you wanted to do it outside of that, we could do that. We can set it up a multitude of ways. But again, remember, there's no cost and there's no obligation for you, the employer. And then if the individual wants a specific meeting, there is no cost or obligation, because if in the end they choose to go on Medicare, the plan pays us. You do not have to pay us, and neither does the employee. The plan pays us if they opt out and go on Medicare.
Perfect, and that answered our last question. Is there a fee to employees for your service?
No.
Perfect, wonderful. All right, well, thank you everyone for attending today's webinar. If you do have any other questions, please contact us at the Fidelity Group at marketing@thefidelitygroup.com. Also, be on the lookout for a recording of today's webinar later this week. And on behalf of the Fidelity Group and Kathy at Kaz Company, thank you for joining us today, and have a great rest of your day. Goodbye.